with the advent of COVID and a lot of being locked in the house, a lot of people have been presenting with anxiety disorders. So today we'll try and tackle a few anxiety disorders, and we'll begin with panic disorder. So a panic disorder is an anxiety disorder characterized by having recurrent and spontaneous panic attacks. So you'd ask yourself the question, how do you know that you have a panic attack? So a panic attack is a period of having sudden and intense fear that lasts over minutes. So one of the people that are highly predisposed to having panic attacks are women between the age of 26 to 34. Additionally, people being treated for other medical disorders such as depression, such as bipolar disorder, and also post-traumatic stress disorder are predisposed to having panic attacks and hence panic disorders if they last long. So the diagnosis of a panic disorder is based on clinical features. Additionally, for the time period that you experience the panic attacks. So you may ask yourself, how do I know that I have a panic attack or a panic disorder? So the panic disorders are characterized by three things. The first is the symptoms you present with. The second is how you adapt to the symptoms. And the third is how long you've been presenting with the symptoms. So the first symptom is sweating. The second is tremors, where you experience shakiness. The third is unsteady gait or a sense of dizziness and lightheadedness. The fourth is elevated heart rate or palpitations. So you'll probably be able to hear your heartbeat even through your ears. Another symptom is nausea. And equally, you may present with chills where you feel cold despite the sun being out or being in a warm area. You may also experience a sensation of choking or difficulty in breathing, and you may also experience a deep or intense fear that you may lose control mentally, or a deep and intense fear of dying. So the second category of our symptoms is if you present with these symptoms for more than 1 month, we are able to better understand whether it's a panic disorder. The third category is if we are able to rule out any other medical illnesses that can cause the panic disorder. For instance, looking at the thyroid function that causes hormones that may present in similar symptomatology. And the fourth and final presentation is people tend to have maladaptive behaviors after having the first panic attack, in that you're constantly afraid that you may have another panic attack, and you're also afraid to go where the initial stimulus you had the first panic attack was. Moving on to how to manage and treat panic attacks and panic disorder. So the treatment involves two arms. The first arm is the short-term treatment, whereby we want to manage what's happening at that very time. The pain, the chest pain, the difficulty in breathing, which are still real symptoms but being caused by intense fear or intense anxiety. So with this, a doctor would prescribe short-term benzodiazepine, and also reassurance has shown to aid the patient in calming down their panic attacks. Another acute treatment that patients can try is breathing exercises while counting down. So you might start from 10, take a breath and count down up until 1, which is able to better control your autonomic response. Now, once you're diagnosed with a panic disorder, the treatment would have to be long-term. Now, the long-term treatment is based on two approaches. The first approach requires psychotherapy, and in this psychotherapy, we deliver cognitive behavioral therapy. So under the cognitive behavioral therapy, we're able to let you or to teach you how to identify thoughts that may lead to a panic attack, because certain thoughts may be able to trigger fear despite there being no danger. So we're able to teach the patients how to differentiate between danger and intense anxiety. The second part of the approach is to identify your behaviors, because the behaviors also affect your thoughts and also affect how your body reacts. Now, the second arm of treatment is long-term treatment with antidepressants. Now, antidepressants offer an increase in serotonin, which may be lower in people who present with panic disorders. It is also imperative that every patient who presents with these symptoms, such as chest pain, difficulty in breathing, tremors, chills, or paresthesias, sees a doctor within the presentation of the symptoms, because the same symptoms could easily indicate very acute illnesses, especially in the older group. It could easily be a heart attack, or difficulty in breathing could easily indicate asthma in the very young pediatric population. So it is very important that when you're having a panic attack, before you're diagnosed with a panic disorder, that you seek medical help first.
Like the name suggests, this condition is characterized by generalized anxiety, which is a state of excessive and unrealistic worry about certain situations and things. So this condition is very common, and it is more common in females, and it mostly occurs in people who are less than 30 years old. So what are the risk factors for getting generalized anxiety disorder? If there is someone in your family that has generalized anxiety, you are at a higher risk of getting this condition. Another risk factor is drug abuse, including alcohol and other drugs. Another risk factor includes people who have undergone physical and emotional trauma. Additionally, you can also have this condition following stressful life circumstances like unemployment and poverty. So what are the symptoms of generalized anxiety disorder? So if you have this condition, it's chronic, usually more than 6 months, where you're in a state of worry, you have headaches, insomnia, which is a failure to get sleep at night. You can also have irritability, poor concentration, and easy fatigability. So whenever you go to a medical professional, they're going to look at certain things that are going to help them diagnose your condition. So you must have had these worrying symptoms for more than 6 months, with 3 or more of easy fatigability, restlessness, insomnia, difficulty concentrating, and difficulty sleeping. When you're diagnosed with this condition, the health professional is going to help you manage this condition. And how do you do this? You can do 2 ways, which is pharmacologic therapy or non-pharmacologic therapy. The more common one, which is non-pharmacologic therapy, includes meditation, exercise, psychotherapy, including cognitive behavioral therapy, and short-term counseling exercises. The other method is pharmacologic therapy that involves the use of SSRIs like fluoxetine, sertraline, and paroxetine.